In this video, let us see about the heart's function and implantable devices. First, let us discuss about the anatomy of the heart. Heart is divided into four chambers: atrium and ventricle, right atrium and left atrium, right ventricle and left ventricle. Atrium is connected to the ventricle through an unidirectional valve. Right atrium and right ventricle is connected by tricuspid valve. Left atrium and left ventricle is connected by bicuspid or mitral valve. Blood is pumped when these chambers contract and relax. Now let us see the electrical system of the heart. Heartbeat is regulated by electrical impulses. The sequence begins as the right atrium is filled with deoxygenated blood from all parts of the body. Left atrium is filled with oxygenated blood from lungs. Electrical signal generated from SA node makes both the atriums to contract. Contraction of atriums pushes the blood into the ventricles. Electrical signals are then picked up by the AV node. From the AV node, the electrical signals are then passed on to the Purkinje fibers through bundle of His. These Purkinje fibers makes the ventricles to contract. During contraction, right ventricle pushes the deoxygenated blood to the lungs through the pulmonary valve. Left ventricle pushes the oxygenated blood to all parts of the body through aortic valve. This process repeats itself to make the cardiac cycle. Compression and expansion of this atrium and ventricle occurs in a rhythmic fashion, and it is due to the initiation of the pulse from the SA node, where SA node is called as the natural pacemaker of the heart. When the SA node fails to function correctly, artificial pacemakers are used. These pacemakers are used to regulate the heartbeat with small, evenly timed shocks. Electrodes are implanted into the heart in one or more chambers. Leads are inserted into the vein near the collarbone and placing the implantable pacemaker, which performs the function of a generator. ICD. Similarly, implantable cardioverter defibrillator ICD can also be placed, which is capable of sensing the stopped heart and delivering an electric shock powerful enough to restart the heart. CRT. For some critical heart conditions, we might need a CRT, which is a cardio resynchronization therapy. This uses a third lead inserted into the left ventricle to resynchronize the left ventricle whenever necessary. These leads can cause problems of their own. Patients with these kinds of implanted devices has a 20% chances of lead failures within 10 years. Lead replacement may need a open heart surgery in few cases. This has resulted in the development of new pacemakers that does not depend upon the placement of leads inside the heart. One such design is the subcutaneous ICD, where the lead is placed outside the heart under the patient's skin. This kind of implantable assist devices are life-saving and need of the heart.